GLP-1 medications are the first medication that we've ever had that gets to the root cause of metabolic disease. It gets to insulin resistance. Most of our medications, think about blood pressure, cholesterol, and blood sugar, diabetic medications. They're getting to downstream symptoms of an upstream problem, which is insulin resistance. We never had a medication that does this, right? That's why we're seeing, after obesity and diabetes, we're seeing a whole laundry list of amazing benefits of GLP-1 medications: autoimmune diseases, GI issues, cardiovascular disease, fatty liver disease, non-alcoholic fatty liver disease, chronic kidney disease. The list goes on, because insulin resistance is not a symptom. It's a cause. Again, this is why I talked about earlier about insulin resistance being the starting point and the most important thing. But getting back to insulin resistance and this being a roadblock. So you probably have heard of this diabetes, for example, doctors think of it as a chronic irreversible disease, right? You become pre-diabetic, then you become diabetic, then you need a little bit of metformin, then a lot of metformin, then a second medication, then an increased dose of that, and then maybe a third medication. Then finally, you're progressing to the point where you need insulin. First, it's a little bit of insulin, and then it's more insulin, and it's more insulin. This is why many doctors consider diabetes a chronic and irreversible disease. Well, I'm here to tell you that that's bullshit. Many functional practitioners will tell you we've helped patients reverse obesity and diabetes all the time. It's not easy. It's a chronic disease, obesity and diabetes. It's very challenging, but it's not irreversible. Now that we have GLP-1 medications, it really helps. It really gives us a better chance, but we still have to do aggressive lifestyle interventions in order to fix it. If we can rule out inflammation, if we can rule out cortisol issues and stress, if we're sleeping really good, if we can rule out thyroid issues, and you're not in a plateau or starvation mode, then this is the focus. This should be your focus.